Hello my dear friends, how are you doing? From whichever part of the world you're watching this video from. I hope you are doing okay. My name is Dr. Luben. I make videos based on health, I give medical advice. I also create a kind of a public awareness on some of the emerging diseases that people should be careful about. In this particular video, I'll be talking about the clinical symptoms associated with prostate cancer. Now, as you know, I've already made a video on prostate cancer. If you've not watched that video, I'll leave that in the description, the link in the description for you to go check it out. And in that video, I did promise to make a video about the symptoms associated with prostate cancer. So if you are new to the channel, you can subscribe by supporting me and also turn on the notification bell so that anytime I release a video like this, you can follow up. You don't need to watch all my videos. You can choose a playlist that suits you and stick to the videos there. So let's not even waste too much of our time. Let's get right into the video. Now, prostate cancer. So just for people who have not actually watched the video I made about prostate cancer, it affects mostly men. I've talked about the fact that you can only find prostate cancer occurring in men and not women. Reason being that prostate cancer comes from prostate gland, and the prostate gland is only located in the male reproductive system. You cannot see it in the female reproductive system. And there are risk factors for prostate cancer. One of the most important is age. So as you reach, clock your 40s, your 50s and 60s, you are more risk as a man of developing a prostate cancer. But now, in the clinical symptoms or presentation, how would you as a man, if you start experiencing some of these symptoms, it could actually make you realize that it could be, most times it's not actually because you have prostate cancer, but it could be. So basically, there are two categories of symptoms. So the first one is symptoms associated with storage, irritating symptoms associated with storage. Those are the kind of symptoms you experience once the bladder is filled up. That's the urine is being formed from the kidney and it goes to the bladder once it's being formed. And then the second category is the symptoms you experience when you are trying to avoid urine. That's when you are trying to urinate. So one of the symptoms that when it comes to storage of urine that will point to prostate cancer is the frequency to urinate. How often do you feel like urinating? Because sometimes your bladder might not even get to the level through which it might want to avoid that, but because this prostate cancer is increased frequency. The second one is urgency. Urgency comes in such a way that whenever you feel like urinating, you cannot hold it anymore. It's as if you don't urinate, you are going to die. That particular symptom, it comes mostly in prostate cancer, and then to some extent there are some other UTIs, so that's urinary tract infections, that can also result to that. The third one is urge incontinence. And what does that mean? No, actually, as a man, when you go to urinate, one of the things you will know if you could have a prostate problem is before you urinate, let's say the urine starts leaking out gradually before it comes out. That one is urge incontinence. So you have the urge to urinate, quite alright, but whenever you go there to urinate, it does not come immediately. It kind of delay, and that delay kind of leak. The urine will be leaking a little bit before it finally comes out. And then the fourth one under this category is nocturia. Nocturia means waking up 1 or 2 to 3 times in one night to urinate. So if you are that man, every single time you sleep, you wake up about 1, 2, 3, 4 times in the night to urinate, then you should go check your prostate. It's possible. Those are actually the symptoms under the category of storage or irritating symptoms when it comes to storage. Now, the second category, which are symptoms associated with voiding of urine. This is when you go out to urinate. This one now, you are urinating. So what are those symptoms that will tell you or point you to the direction of prostate cancer? The first symptom there is straining. So when you go to urinate, you can't stand straight and urinate. You have to strain yourself before urinating. Now, don't get this confused. There are you might be suffering from some other UTIs, or maybe urinary tract infections that can actually make you strain in urinating. But for prostate cancer, it's more stronger, it's more powerful every single time. And then for men, sometimes they strain to urinate mostly in the morning when they wake up. A lot of men do that. It does not literally mean they have a problem with their prostate. It's just naturally they do that because of hormones and all of that. But for prostate cancer, every single time they want to urinate, they have to strain. The second symptom under this category is hesitancy. So you go to urinate, right? And then before that urinate comes out, you stay there for a very long time. Maybe about, some people before they urinate, they stay about 2 to 3 minutes. That's tell you how severe it has got to. Maybe 1 minute before urine start coming out. That's hesitancy. So if you haven't maybe experienced that kind of symptom, that will tell you possibly that there could be a problem with your prostate gland. The third one is intermittency. Now what this actually means is, okay, now the urine finally comes out, but then it will come out and then stop at a point. Come out and stop at a point. That's actually intermittency. So if you experience that kind of a symptom, then normally you should know very well that there's something wrong with your prostate. The fourth one is poor or weak stream. So yes, the urine is coming out quite alright, but it's not coming out naturally how it's supposed to come out. It's supposed to be convex. Although as you progress in age, it will not literally be that convex. It will decrease. The convexity of your urine, how it's streaming, it will kind of decrease. But in people who have a problem with their prostate, the stream is very poor. Sometimes it's just as if it's just dropping or it's just splashing, and then it will kind of splash a little bit and go back. The fifth one is spraying. This one actually, happens in a situation, or it kind of occurs in the sense that the urine will split. Normally when you are urinating as a man, it's supposed to come out in just one stream. But this one now, it splits, and then some will be going one side, another will be going one side. Now in this particular symptom, though, the thing is, there are other urinary tract infections that can also give this particular symptom. But your age, you also have to consider your age. When you start seeing this at the age of 40, 50, then definitely you should know that there's something wrong with your prostate. The sixth one is terminal dribbling. This one is, your urine is just, from the word itself, dribbling. The urine is not coming out straight. Normally it's a connection with the other ones which I just mentioned, but this one is just dribbling. It's not actually going one place. It will go here, come here, go here. It's not actually positioned in such a way that it's going out at a focus point. It's dribbling. It's kind of scattered. I think it goes back to one of the symptoms I just mentioned. That something is wrong with that. And then the seventh one is dysuria. This one actually comes from pain during lactation or pain during urinating. So as you are urinating, you are having a lot of pain. In some people, maybe that pain they are getting could be from other urinary tract infections. But for prostate, every single time you urinate, it accompanies pain. The eighth one, and this one is also important, is incomplete bladder emptying. I just put it that way. Whenever you urinate, let's say after going to the toilet or after urinating, you still feel as if there's some of them left inside your bladder that's not come out. That one is even very, very important. In fact, if you have that kind of a symptom, judging according to your age, you should know very well that something is wrong with your prostate and go check it out. Some of these symptoms though might not actually be because you might experience them, but it might not actually be because you have a problem with your prostate. It could be that you have a urinary tract infection. So the best thing to do is just to go check yourself. So thank you so much for watching. That's it for the video. I hope you enjoyed it. Please, like I said earlier, you can support me by subscribing to the channel and also turn on that notification bell so that anytime I release a video like this, you will probably be the first person that will watch it. Thank you for watching. See you in another video.